The Moment of Truth Physical Therapy is here to talk about pelvic physical therapy, and Amy let me make sure I said Vander Linden.
Correct.
Did I say, Amy, how are you doing?
I'm great. Thank you so much for having me.
You know, this is very interesting that probably a lot of people there don't know about this, and those that do probably are kind of like, what do I do? How do I do this? Where do I find out about it? But first, let's talk about Moment of Truth Physical Therapy and what you do.
Thank you so much, Brad. Yeah, so at Moment of Truth Physical Therapy, we have several therapists, and it's absolutely true. Most women have no idea that pelvic physical therapy exists or how we can help them or what exactly is going to happen when they come in. And we actually have created a free kind of consultation so that women can come in and learn more about it before they really commit their time or money to services. And so we work with a lot of pregnancy and postpartum, helping women have a much more healthy and active pregnancy, an optimal delivery, a faster recovery, and just really trying to differentiate between common and normal. A lot of things might be common during pregnancy or postpartum, but that doesn't mean that they're normal or that they aren't treatable. And so we just really try to help educate on their body and what to expect and how to really prepare and then heal.
Yeah. All right, so when it comes to the pelvis physical therapy, what is pelvis physical therapy?
Yeah, so we still treat the whole body, and we, at our practice, we specifically emphasize a manual therapy technique, but pelvic physical therapy really focuses on the main functions of the pelvis, reproductive, sexual, supportive, all of those aspects. And really with pregnancy and postpartum, the emphasis is even more so on all the changes that are going to occur during pregnancy. And maybe some women might be having pain. Of course, back pain is one of the most common things. Pubic bone pain, which is more in the front. Leaking urine, things like that happen that women are so often just feel helpless. They think, oh, I'm just gonna have to deal with this until I have the baby, which is often not true. There's a lot we can do to make their pregnancy a lot more comfortable and resolve those symptoms. And then of course, helping them with a better recovery and that transition into motherhood, which is huge.
Yeah, I mean, because there are, I've seen people, the jazzercising, the exercising while you're pregnant that helps and stuff like that. But this goes a little bit more where you're actually kind of like helping them guide through what they're going to be doing, and what they're going to be having done after pregnancy and stuff. And that's what the big thing is, that you're guiding them through certain areas that are very important here.
100%. And we help them have the confidence to know what exercises are going to be safe and best for them. The standard kind of used to be that just keep doing whatever you were doing before pregnancy, but the research has really shown that the benefits of exercise during pregnancy for both the mom and the baby far outweigh any risks associated with exercise, and so we really help women have the confidence to get going. But in our space, we focus more on the manual therapy, the hands-on touch to help release tight areas, strengthen weak areas. We do both external and internal pelvic floor work to help all of those structures.
Yeah. Does the husband or the father ever get involved to come into therapy with them?
Absolutely. We really encourage dads to come in. They often don't, and sometimes they're home with other babies and kiddos in the family or at work, but we definitely encourage them to come in, especially as we get close to delivery and they want to be involved in that delivery and some things they can do to help with pain. Another factor with our work, when you think about the statistics around miscarriage, infertility, abortion, molestation, sexual trauma, and then even some of the birth trauma that occurs, the chance that a woman walking into our space hasn't dealt with some sort of trauma in her life is super unlikely. And so all of our care is very trauma informed. A lot of times the clients aren't even really aware of that in their systems. And so we just create a safe space for them to heal on a deeper level and really try to acknowledge all of the things that they might be holding.
Wow, that is amazing, Amy. So I tell you, that is great. I'm so glad you came in, because again, it's opening up people's minds and opening up their ears too. There's a place for them to go and learn about this and everything. So where can people find out more about, of course, Moment of Truth Physical Therapy and this pelvic therapy?
Yeah, so we're in the West Valley over in Peoria. Our website's momentoftruthpt.com. We're also on Facebook and Instagram, and we have a lot of educational resources on our website that we encourage women to grab. A bunch of free reports, information. We also treat babies, and so just lots of resources and tips to help moms. And women so often go years undiagnosed with different pelvic pain and the fact that it's not talked about. And so I really appreciate the opportunity today.
All right, great, Amy. Well, thanks for joining us.
Yeah, I appreciate having me.
So, all right, there you go. Again, we'll have information on aztv.com if you missed all, where you can find out more about Moment of Truth Physical Therapy. So, all right, stick around. More Mix right after this.